Is the location of your headache telling you something? I'm Dr. Madan Kandula with ADVENT. Today, talking about headaches and sinus issues and how sometimes those things can come together. Many folks suffer with headaches. Many, millions and millions of folks. Sometimes, fortunately, these are temporary issues. But for many people, these are constant or intermittent or things that are happening over time consistently, which is very debilitating. The challenge with headaches is that it's behind the scenes. Headaches can make you feel miserable and do make you feel miserable, will make you feel miserable, yet it's behind this facade. And so, what can be happening behind the scenes isn't necessarily evident to those around you. There are many types of headaches. There are tension headaches, migraine headaches, sinus headaches, Tmj headaches, on and on. There's actually hundreds of types of headaches, so I'm not going to be able to cover all of them, today. But I would say there's a common thread, which is misery. Anybody who's ever had a headache knows how miserable they are. And there are degrees of misery that they can cause depending on the severity or the other signs and symptoms that are there. Location, which is kind of the focus today, can be one sign or symptom. It isn't necessarily consistent, but I'd say it is a helpful clue as to where some of the problems may lie. So just for starters, I would say, just so everybody knows, your sinuses are air-filled pockets around your nose. So you have sinuses in your forehead, sinuses between your eyes, sinuses in your cheeks, and obviously you got a nose that's in the middle of your face that connects all those things. So each of those sinuses are air pockets within the bone that have openings into the nose, and so that's where the sinuses exist. So if somebody is having pain or headaches overlying those sinus areas, then could that be a sinus issue? It could be. The challenge is sometimes that can overlap with other issues and vice versa. And so, where it gets kind of tricky is if somebody's having an active sinus infection, then usually they'll know about it with some other symptoms. They'll have maybe discolored mucus or thickened mucus or other things that go along with that. Though folks can have what we call chronic sinus infections, which is basically chronic inflammation within the sinuses that's ongoing, that doesn't necessarily give you the clues that an active infection does. And so those same folks could be, their only clue for trouble might be a headache issue. And so, again, the sinuses exist in very specific locations. That gives us a clue and maybe you a clue as to where trouble might be coming from. There are other types of headaches. Tension headaches are headaches that happen in the muscles around the head and the neck area. And so if those muscles are kind of tensed up, then that can literally just give you pain within those muscles. And Tmj issues are issues that your Tmj joints are the joints that open your mouth and close your jaw. Same thing. Those areas can be irritated if somebody's clenching their jaw at night, if they're grinding their teeth. Some folks just have problematic Tmj areas, and so they can feel pain in the ears or in the muscles surrounding those areas. So not to confuse you, but there's a lot of area that can create trouble. Some of those areas do overlap. If somebody does have sinus issues, they might have headaches overlying the sinuses, but unfortunately, for folks trying to pin down the area of trouble, is some folks who have sinus issues can have headaches on top of the head and the back of the head. So some of these things can kind of go hand in hand where you wouldn't necessarily, there aren't sinuses in the back of your head, for instance, but some folks who have sinus headaches can actually have headaches in the back of the head as they're presenting symptoms. So, sinus headaches can be one type of headache. Migraine headaches are another type of headache that I haven't really talked about yet. But migraine headaches are triggered in the same areas and can be debilitating. So migraine headaches tend to happen sporadically, meaning they can kind of happen here and there. Some folks have specific triggers, other folks don't. Some folks can know that they're coming on, other folks don't. Migraine headaches really kind of create a ripple effect throughout somebody's neurological symptom. So the difference between kind of a typical headache and a migraine headache is a migraine headache will give you a headache. It will give you potentially the worst headache of your life and will potentially give you other things that you might not connect back to a typical headache. You can get a little bit of blurry vision, you can get dizziness, you can get sick to your stomach and actually throw up from a headache. So those are all things that are most typically associated with migraine headaches. And migraine headaches can actually kind of happen in various areas. For most folks who have migraine headaches, they tend to happen in fairly consistent areas if they're happening repetitively over time. So long story short, I think if you have headache issues, It's a real and significant issue, period. It can be a real challenge to get to the bottom of. And I think for us as a practice and us as a specialty, what we can help with is to kind of tease out what the headaches may be versus what they might not be. So for instance, if somebody has migraine headaches and migraine issues, doesn't mean that they don't also have anatomic issues or inflammation issues within their nose and sinuses. And many folks actually have triggers within the nose and sinuses that can push them into a migraine headache, for instance. And so for us, it's really trying to understand the anatomy about what is there, what isn't there. And so if somebody's having headache issues, for instance, and we're trying to evaluate where are these headaches coming from, we're likely going to get them set up to get imaging done of the nose and the sinuses to see what's happening behind the scenes. If we see that there's inflammation in those areas, and or if we see areas that are too narrow, or we call them contact points, which are areas that are actually touching on the inside of the nose, then that doesn't necessarily mean that is absolutely where trouble is. But we want it on our radar screen, and we want to know if it's there or if it's not there. If somebody's having headache issues and everything looks nice and clean, nose and sinus wise, we can kind of safely say it's not likely related to those areas and kind of move on. If though, on the other hand, we are seeing issues, then oftentimes it makes sense to address those issues to see where that takes somebody and then kind of go from there. So many folks who have headache issues can have multiple factors that kind of come together to give them those headache issues. And any of the factors that can be, sort of taken away, we want to take them away. For those folks who don't have any specific anatomic issues that are causing headaches, then there are medications and other things that can help. But for those folks that do have anatomic issues, from my vantage point, it does make sense to identify those issues, correct them if it makes sense, and then move on from there. So location can be a helpful factor if you have headache issues. Headache issues are really a significant issue, a significant problem for a lot of folks. Getting to the root cause of that problem is really the be-all, end-all. That's what you want to try to do to try to get to the solution that's right for you. And you start that by having some understanding about the issues. You start that by really seeking out care in a place that can kind of get to that root cause and going from there. So headaches, location can matter and give you some clues as to kind of where that next step might be, and hopefully get you towards relief.